Next is about कासप्रतिषेधम् अध्यायं व्याख्यास्यामः यथोवचबन्धनन्तरिः उक्ता ये हेतोवन्द्ॄणां रोगयोः श्वासहिक्कयोः कासस्यापि सविज्ञेयाः त एव उत्पत्तिहेतवः. The etiological factors which are mentioned for the shwasa and the hikka are also the causes for the kasa or coughing. धूम उपघात रजसस्तथैव व्यायाम रुक्षान्न निषेवणाच्च विमार्गगत्वादपि भोजनस्य वेगावरोधात् क्षवतोस्तथैव प्राणो हि उदानानुगतः प्रदुष्टः संभिन्नकांस्यस्वनतुल्यदोषः निरेति वक्त्रात् सहसा सदोषः कासः सविद्वद्भिः उदाहृतस्तु. The definition of kasa and the etiological factors, specific etiological factors are the smoke, exposure to the smoke or dust, or excess of exercise, or consumption of dry junk food, or due to the improper movement of the food consumed, that's aspiration, that instead of the food going to the gastrointestinal tract, if it enters the respiratory tract, that's a bhojana vimargagamana. Begavarodhat, suppression of the kshavatu, sneezing, suppression of the sneezing urges. The involvement of the prana with the udana results in a situation where the person would be producing the sudden expulsion of the air from the respiratory tract with a sound resembling that of a broken bronze vessel, and that condition is called as a kasa. Definition of kasa is प्राणो हि उदानागतः प्रदुष्टः संभिन्नकांस्यस्वनतुल्यघोषः निरेति वक्त्रात् सहसा सदोषः कासस्य विद्वद्भिः उदाहृतस्तु. स वासपित्तप्रभवः कफाच्च क्षयात् तथा क्षतात् तथा अन्यः क्षयजो अपरश्च पञ्चप्रकारः कथितो विषयभिः विवर्धितो यक्ष्मविकारकृतः स्यात्. The kasa or coughing is categorized into 5 categories: Vataja, Pittaja, Kaphaja, and Kshataja and Kshayaja. And if it is not treated properly, in due course of time, when it becomes chronic, it results in a severe disease, yakshma. I don't say it's Radha yakshma, we do not translate as tuberculosis, but yakshma is a emaciating disorder. It can result in emaciating disorder. भविष्यतस्तस्य कंठखंडुः भोज्योपरोधो गरतालुलेपः स्वशब्दवैषम्यम् अरोचको अग्निसादश्च लिंगानि भवन्ति अमूनि. The Purvarupa prodromal symptoms of a Kasa Vyadhi is the patient would have itching in the throat, and that could be a feeling like the food which is consumed is not moving properly, and there could be coating over the throat area, and there could be abnormalities of the voice, dysphonia, sound could be abnormal, or arochaka and agnisada, dyspepsia and anorexia can be the clinical symptoms of the kasa as it is coming up. Now, cough as such is a protective reflex, and it's a physiological response to any irritation in the respiratory tract. The protective reflex to expel any of the obstructions or any of the irritants in the respiratory tract, the cough is produced. And physiologically, from the functional point of view, cough has 3 phases: inspiratory phase, compression phase, and expiratory phase. The inspiratory phase, there would be a deep inspiration, and after that there would be a situation where the pressure in the whole respiratory tract is increased by closure of the epigastric, closure of the epiglottis, as well as the contraction of the abdominal muscles and respiratory muscles. The pressure increases enormously, and then there is a sudden opening, and there will be sudden expulsion as such. So the larynx closes, the muscles of the chest wall, diaphragm and abdominal wall contract in the compression phase, and then there is a sudden opening of glottis, resulting in a sudden flow of the air, and that increased sudden flow of the air is meant to expel out any of the obstructing pathologies. That's the physiology of cough, and this physiology of the cough is controlled by the multiple centers. It has also a voluntary and subvoluntary the involuntary component. Like the voluntary, like whenever there is an irritation in the respiratory tract, right, there would be an input of cough sensory input, which could be like irritation as such, and it reaches the subthalamic centers, and there could be from the subthalamic center there could be a irritant lower reflex which is totally involuntary, which can stimulate the respiratory muscles. Along with that, there also would be a subcortical processing reaching the sensory area, and the motor process also occurs. So there can be a voluntary component also. So in the beginning, primary cuff reflex is just at the respiratory center. There will be a stimulation of respiration and some cuffing can occur, but it also can occur it can also be a voluntary, where the person can induce the cuffing by his own, or there could be combination of both. So in a typical disease condition, you will have these situations. The voluntary components of the cuffing can be blocked by anesthesia, antidepressants and anticonvulsants. The involuntary component of the cuff can be blocked by opioids or antagonists, GABA agonists and sigma agonists. They can suppress these cuffing activity. Now, as per the ICD codes, the cuff is classified into acute cough, subacute cough, chronic cough, and cough syncope. Cough syncope is when due to the cough a person faints as such, or other specified cough due to some specific disease conditions, and cough is unspecified. Causes of the cough could be many. See, there could be lots of causes: irritation of the respiratory tract, presence of any irritant substances in the respiratory tract can produce a cough, and hence the clinical approach to a cough in an adult. Now, cough in a child pediatric condition has some more additional factors like aspiration, but when it is an adult, the usual protocol of dealing with the cough would be, if the cough is less than 3 weeks, which is acute, then if the patient you have to examine the patient's vitals, whether the patient is toxic and air hungry, like if there is a serious issue of the air exchange, then immediately you have to go for assessment of the oxygen saturation, spirometry, and if necessary respiratory support would be done. If this is not there, if the signs like vital signs are normal and the patient has a cough as such, then whether there is a sputum or not, if the patient is having a productive cough or not. If there is no productive cough as such, it's a non-productive cough, it's usually upper respiratory tract inflammation, and of course the current protocol is antihistamine, etc. Like I am not going to that part, but we can manage the patients with Mrityunjaya, Arogyavardhini, Amrita Arista as such simple cold-like conditions. If the patient has a productive cough, sputum is there, that suggests you of a lower respiratory tract or bronchitis. In such conditions, you will have to do something by which the productive cough, that sputum has to be expelled out. The secretions have to be clear. To clear the secretion, we will have to use some Lekhana Dravyas, Tikshna Dravyas, like I would be preferring either Talisati or Sitopalati or maybe even Laksuta Mishrana along with the Mrityunjaya, Arogyavardhini, etc. At the same time, if during this situation, if the patient has a signs of obstructing, like the evidence of Rankai, then we will have to treat that patient as a Shwasa, and Shwasa Kuthara also can be given. Now, if it is a definite post-infective, patient has a cough or persisting for 3 to 8 weeks, and there was a history of some cough, these infections as such, and you have a definite history of infection, post-infective, then you will have to think of the post-infective cough, where again the similar drugs are given, and from the contemporary modern point of view, it's the bronchodilators. From our point of view, it is the Shwasakuthara like drugs are to be given. So I am not dealing with this contemporary protocol of the treatment, I am just suggesting from our point of treatment. And when you have the Rankai, that is a sign of the Vataja condition. When you have the crepitations, that is a sign of Kapha. When you have the fever, that is a sign of the Pitta. Now, if it's a persisting still and the infective causes are still there, and then you will have to consider the other secondary causes. The secondary causes like environmental causes, like where the patient may have some exposure to the irritants, asthma, that's chronic obstructive pulmonary disorders, or gastrointestinal reflux disorders also can produce the cough. Upper anatomy, these abnormalities, like patient may have some abnormalities or compression of the respiratory tract, etc. Or it could be like the patient may have a lower respiratory tract obstruction somewhere, and these need to be studied by imaging studies, x-rays, or maybe if necessary bronchoscopy, and protocol of the treatment has to follow accordingly. If the persisting for more than 8 weeks, if the patient is a smoker, stop smoking. If you consider this as a chronic obstructive pulmonary disorder, then the treatment has to be prolonged treatment with the same Shasakutara, Lagusudha Mishra, or maybe Makaratoja like conditions have to be given. Rasayana Aushadhis also may have to be given. That's how the treatment protocol is done. Now, from the theory, Samhita point of view, the signs of the Vataja Kasa are Hrichanka Murdha Udara Pashashuli Kshamanana Kshina Balaswarojaha Prasaktam Antakafam Iradena Kaset Shushkam Sarabheda Yuktaha. A Vataja Kasa would be a dry cup where the sputum would be lesser, and even to bring out the sputum, patient has to put in more effort. Along with that, the patient would have headache or pain in the abdomen, or even at the sides there, and the patient may have a emaciated look. The voice also could be affected. That's a sign of Vataja Kasa, and most of the dry cough conditions which we see is diagnosed as Vataja Kasa. Gurovidaha Jwara Vaktashoshihi Abhyarditaha Tikta Mukhastrishartaha Pittena Pitani Mumet Katuni Kaset Sapanduhu Paririkhyamanaha. A patient with the Jwara and dryness of the mouth or burning sensation over the area, excess of thirst, and even there could be vomiting. Such condition is called as a Pittaja Kasa. And Pravilipyamanena Mukhena Sidan Shirorujartha Kapurna Deha Abhaktar Gaurava Sadayukta Kasetana Sandra Kapam Kapena. In case of the Kapaja Kasa, patient would have a thick sputum. Thick sputum is usually a sign of a lower respiratory tract infection. And the patient would also have that thickness or sticky substance in the oral cavity. A headache can be seen, and the patient may have pain in the, even when the patient doesn't consume the food. Empty stomach also, that could be pain. Vaksho atimatra mihatantyasya vyayama bhara adhyayana abhigataihi vishlishtha vakshaha sanarasraktam stivati abhikshnam satajam tamaho. Kshataja Kasa would be having a history of patient, some trauma which could be produced due to excessive exercise or carrying heavy weight or loud speech also. Adhyayana, the word here we have to interpret as a loud speech. Adhyayana word otherwise is study, so simply studying or reading a book may not produce a cough, but loud sounds can produce sounds, and the patient would have a feeling of pain in the chest, and there could be hemoptysis, even blood mixed sputum may present there. Vruddhatvam asadhya bhavet to yovai yapyam tamaho vishajastu kasam. If the kasa becomes persisting for a long duration, chronic cough becomes yapya. The protocols of the treatment mentioned in Samhita are Shringi Vacha Katphala Katrana Abda Dhanya Abhaya Bharangi Amara Vishwam Ushnambana Hingu Itum Tupitva Badhasyam Abhyashu Jahati Kasam. The yoga where Mesha Shringi Vacha etc. are given. It's a very efficient treatment for the kasa, even if the patient is not able to close the mouth. That means persistent cough can be managed. Phalatrika Vyosha Bidanga Shringi Rasna Vacha Padnaga Devakashtaihi Leha Samik Shaudra Ghraktaha Kasam Nihatyat Achirat Udirnam. Another of the Kasa Yoga where Triphala and Triphala Vyosha, that's Maricha etc. are given in the form of Leha. Then Tathyam Sitam Amalakani Lajam Lapsamagadhim Chapi Viturnishunthim Sarpir Madhubhyam Vilihi Takasi Sasaindavam Va Ushna Jalena Krishnam. Another of the Leha Yoga where the Haritaki and Sita etc. are given. Khade Gudam Nagara Pipalibhyam Draksham Sarpihi Madhuna Abalshyata Draksham Sitam Magadhigam Chutulyam Sasunga Veram Madhukam Tugam Cha. Rishad Gatak Shaudra Idam Samamsham Sitopalam Va Marijam Shayuktam Dhatri Kana Vishwa Sita Uparashcha Sanchurne Mandena Pibetadagnaha. The other yogas where Buddha, Nagara Pipali, Draksha etc. can be given. So usually some sweet and something which produces soothing effect also can be given in such conditions where there could be irritation in the upper respiratory tract or the oral area. हरेणुकां माघतिकां चतुल्यां दग्धा पिबेत् कासगदाभिभूतः उभे हरिद्रे सुरदारशुण्ठीं गायत्रीसारं च पिबेत् समांशं बस्तस्य मूत्रेण सुखाम्बुना वा दन्तीं द्रवन्तीं च सतील्वकाख्यां भ्रष्टानि सर्पिंषि अथ पादराणि खादेत् पलाशानि ससैन्धवानि. Another of the yoga where the drug could be given and bastamutra, the urine of goats with the water also can be suggested as one of the protocol of the treatment. Kola pramanam prabhivedhi hingu savirakena amlarasena vapi. Hingu with them savirakasa or any other amlarasa. Mustra ingudi twak maduka mamsi manashiralehi chagalambu pishtihi पिदाहय वर्तीश्च पयोनुपानं धूमं पिबेत् वातपदासकासि पिबेच्च सीधं मरिचा अन्वितं वा तेनाशुकासं जयति प्रसह्य. Another of the धूम yoga, the धूमपान yoga. द्राक्षा अम्बु मंजिष्ठा पुराह्वयाभिः क्षीरं श्रुतं माक्षिक संप्रयुक्तं निदिग्धिका नागरपिप्पलीभिः खाद्यच्च मुद्गान् मधुना सुसिद्धान्न. The other dietary supplements like उत्कारिकां सर्पिषि नागराढ्यं पक्त्वा समूलैः त्रुटिकोलपात्रैः येभिः निषेवेत कृतां च पेयां तन्वीं सुशीलां मधुना विमिश्रम्. Utkarika has to be prepared. Utkarika is a puri has to be prepared with the shunthi and trutika kolapatra. विरेचनं स्नैहिकमत्र च उक्तम् आस्थापनं चापि अन्वासनं च धूमं पिबेत् स्नैहिकम् अपरमद्धः पिबेत् सुकोष्णं घृतमेव चात्र. हिताय वाग्वश्च रसेषु सिद्धाः पयांसि लेहाः सकृतात्तदैव. स्नैहिक विरेचन or आस्थापना, अनुवासना or धूमपाना also can be given with the sneha contents in it. And the sukhosna grita, warm grita has to be given. प्रच्छर्दनं काय शिरोविरेकाः तथैव धूमाः कबलग्रहाश्च उष्णाश्च लेहाः कटुका निहन्युः कपां विशेषेण विशोषणं च. In general, in a कफजकासा, वमन, कायविरेक, शिरोविरेक, धूमपान, कबलग्रह, उष्णलेह can be given. कटुत्रिकं चापि वदन्ति पथ्यं घृतं कृमिघ्नस्वरसे विपक्वं निर्गुण्डिपत्रस्वरसे च पक्वं सर्पिक् कफोत्थं विनिहन्ति कासम्. Another of the कफहर yoga. पाठा विडंग व्योष विडंग सिंधु पाठा विड व्योष विडंग सिंधु त्रिकंटका रास्ना आहुत भुग्बलाभिः शृंगीवचा अंबोधर देवदारु दुरालभा भारंगी अभया शटीभिः सम्यक् विपक्वं द्विगुणेन सर्पिः निधिकृतायाः स्वरसेन चैतद श्वासाग्निसाद स्वरभेदभिन्नान् निहन्ति उदीर्णान् अपि पञ्चकासान्. All the varieties of the kasa can be treated with this yoga. Vidari gandha uttala sarivadi nishwatya vargam madhuram cha krishnam dhritam pached ikshurasam dugdhaihi kakoli varge cha sashashkaram tad pratap pibet pittakrite chakase ratik prasute kshatraje chakase. Vidari gandhali gana yoga with the madhura dravyas are used to in the pitta jakasa as well as the kshatra jakasa or kasa produced due to excess of sexual activity. रक्ता हरिद्र अंजन वन्यपाठ मूर्व उपकुल्या विलिहेत् समांशाः क्षौद्रेण क्षतजे क्षयोक्ते विवेद्वृतं च ईश्वरसे विपक्वम्. Another of the क्षतज and क्षयज कासा treatment. चूर्णं पिबेत् आमलकस्य वापि क्षीरेण पक्वं सदसं हिताशि गुडोदकं वा कथितं पिबेति क्षौद्रेण शीतं मनिजोपदंशम्. Amalaka churna with the kshira is also suggested. Prasatrayena amalakirasasya shuddhasya rattva ardhatulam gudasya churnikrite grantika chabya jira vyosha ibha krishnaha hapusha adamodehi vedanga sindhu tripala yavani patha agnidhanishcha bichu pramanihi dattva trivarta churna palani cha astau tailasya prajet yathavada. सबक्षेद अक्षफल प्रमाणम यथेष्ट चेष्टः त्रिसुगंधियुक्तम अनेन सर्वे ग्रहणे विकाराः सश्वास कास स्वरभेद शोताः शाम्यन्ति चायं चिरम् अन्तरग्नेः हतस्य पुंसस्य च वृद्धिहेतुः स्त्रीणां च वन्ध्यामयनाशनः स्यात्. कल्याणको नाम गुणप्रतीतः. कल्याणकगुण another of the yoga and the medicine is available in the same name which can be used in many other diseases like grihadi vikara along with the Shwasakasa as well as Agni Mandya and Vandhyan impotency also. Dipancha Mula, Ibha, Karna, Atmagupta, Bhangi, Shati, Pushkar, Mula Vishwana, Patha, Amra, Grantika, Shankha Pushpi, Rasna, Agni, Apamarga, Bala, Yavasan, Vipalikan, Yaste, Yavadhakam, Haritakinam, Sharam Gurunam, Drone, Jalasya, Adhaka Sanyute, Kwate, Krite, Puta Chaturtha Bage, Pachet Tulam, Shuddha Gudasya, Prutak Tailas, Pudavam Bhatacha, चूर्णं च तावत् मगधोद्भवायाः देयं तस्मिन् मधु सिद्धशीते रसायनात् कर्षम् अतोलिष्य विलिष्यात् द्रवे च अभये नित्यम् अथाशु हन्यात् तद्राजयक्ष्मा ग्रहणी प्रदोष शोभ अग्निमान्द्यस्वरभेदकासान् पाण्डवामय श्वास शिरोविकारान् हृद्रोगहिक्का विषमज्वरांश्च मेधा बलोत्साहम् अतिप्रदं च चकार एतद् भगवान् अगस्त्य रसायन the product is available in the same name as Agastya Rasayana. Of course, later derivation of a similar drug, a modification is a Chyavanprasha later on. Some of the companies call the Chyavanprasha also, name the Chyavanprasha also as Agastya Rasayana, but primarily the Agastya Rasayana mentioned in Sushruta is the same where the Dashamula, Vibhakarana, the big yoga is well, and the drug is available in the same name and it's quite useful in chronic cough conditions. Kulira Shukli Chatake Yena Lavan Nishkatya Vargam Madhuram Chakrisram Pachet Dhritam Tat Nishevemanam Hanyak Shatotham Chayantakasam Shatavari Nagabala Vipakwam Gridam Vidheyam Hidayakasinam. The other yogas for Kshajakasa and Kshajakasa. With this, the Kasa treatment is over. It is Sushruta Samhitayam Uttaratantrantale Kachikisa Tantresh Kasa Pratishedho Nama Chaturdashodhyaya Aditaha Dipanchashattamo Adhyaya. We will continue with the next chapter also. The Sarabheda Pratishedha Adhyayam Vyakhyatsyamaham. Ethovacha Bhagavan Dhanvantarihi Atyucha Bhashana Visha Atyucha Bhashana Visha Adhyayana Atigita Shitadivihi Prakupidaha Pavanadeyastu Srotatsute Swaravheshu Gataha Pratishtham Hanyuhu Swaram Bhavati Chapicha Shadvidasaha. Swarabheda is a dysphonia, abnormal sounds, voice abnormalities. Now, voice abnormalities are a group of conditions which can present due to multiple causes, and the approach for them is also according to the cause as such. And Sushruta suggests like the causes could be like Atyucha Bhashana, speaking in very loud sound, or Visha due to toxic substances, Atigita Shitadivi due to singing too much or reading too much, like, and exposure to the cold. The vitiated doshas would produce an abnormality of the Swaravaha Srotas, the laryngeal structures, which results in abnormal sound. So probably the Swarabheda mentioned in Sushruta is limited to the peripheral causes of the dysphonia. Vatena Krishna Nayana Anana Mutravarcham Bhinnam Shani Vadati Gadgadavat cha. In Vataja condition, the patient would have a blackish color in the face and the sound would be very low, intensity of the sound will be low, and there will be Gadgada, broken voice as such. Pittena Pita Vadana Akshipurusha Mutraha Burya Gadena Paridaha Samanitena. Patient would have burning sensation in the throat and the sound would have a low pitch as such. The pitch would be low, and along with that the patient may have a yellowish discoloration in the face and other areas. Krishrat Kafena Satadam Kaparuddha Kantaha Mandam Shanehi Udati Chapi Diva Visheshaha. A Kapaja Swarabheda would present with a blockade in the neck, and the sound would be very low. Intensity of the sound would be low, and the intensity would be, abnormality could be more in the daytime. Sarvatmake bhavati sarva vikara sampad avyaktacha vachasaha tam asadhyam aho. Sarvatmaka condition, Tridoshaja condition would be presenting with all the symptoms, and the person's sound would be inaudible. You are not able to make out avyakta, and such condition is asadhya. Dhupyata vak kshayakrite kshayam apniyacha vag esha chapi hatavak parivarjaniyaha. Due to the kshaya, the patient would have a sound which is something like a whistling sound. Dhupyata is a whistling like sound, and the sound also would be having progressive reduction in the intensity, and that is considered as asadhya. as well as the phonetics are concerned. Now, phonetics and voice training, speech therapy is a very specialized branch in the contemporary science, and we will not go into much detail. Basics, of course, we will consider the basic as such. To voice, the production of the voice, there are two components. One, the central nervous system components, where the speech has to be formed and the speech has to be executed through the different centers, and that part is something which we will consider as a aphasia or abnormality of the speech formation. Whereas if the patient has a central system being normal, but the executive organs are not functioning properly, the executive organs are in the sense the larynx, the muscles related to the sound production, that's called as a dysphonia. So dysphonia and the dysphasia, these are the two words used. Dysphasia is where the speech formation is abnormal. Dysphonia is where the speech execution is not abnormal. In the phonia, that's the speech formation, the major organs involved are the basic formation of the speech would be the windpipe or the trachea, and the abdominal muscles, diaphragm, stomach also would have a role. The abdominal muscles have a role to produce that the air to move up, and a controlled movement of the air through the vocal cords, which gives that resonance, as well as the palate, the soft palate and the hard palate, and the lips also add to the quality of the sound, and the sound is produced by modifying the pitch of and the flow pressure as well as the intensity of the flow of the air, as well as the resistance given to the air by the vocal cords. So the whole process is a very complex process, and it is a voluntary. Now, as far as the production of the sound is produced, considered, there is a very significant advanced description of the sound in our grammar, Sanskrit grammar as such. And in the Panini Sutra, the specificity, the organs which are involved, or the location of the organs involved, though it's not described in terms of the muscles as we described in the anatomy, it's a very perfect description of the production of the sounds, the description in the Panini. And the Akoha Vichadyanam Kantaha, Ichuveshanam Talu, Ratadashanam Murdha, Rasanam Dantaha, Upadmaniyanam Bostau, Yamagananam Nasikata, Edeto Kantasalu, Bodoto Kantosum, Karasidantosom, Jifam, Yes, Jifam, Mula Manasaras Nasika. These are the Pranini Sutra, basic Pranini Sutras, and the further description, Vikakha iti Kakha Byam Praka, Ardhavisarga Sadasho Jifam Mulyaha, Papha iti Papha Byam Praka, Ardhavisarga Sadasho Padmaniyaha, Ammaha iti Achaparo, Anuswara, Vistargo. These are all the sutras which we have studied somewhere. But the importance is a very advanced phonetics. In the contemporary science also, this kind of a phonetic is not described properly, but all of them are perfectly proper, and it's a very advanced, and many people have appreciated this part. Anyway, that's about one issue. Now coming back to the issue of dysphonia, abnormalities of the sound from the current approach point of view, causes of the dysphonia could be like either inflammation of the area involved, upper respiratory tract involved, like larynx or vocal cords may be involved, or it could be due to viral illness and so on. Allergies, there could be some swelling of the vocal cords, cough or postnasal drip, etc., which can present with the acute dysphonia. Or laryngopharyngeal reflexes, like patient may have the gastroesophageal reflex disorder, that vocal cords could be produced, or vomiting, like if you have vomiting, after vomiting the sound could be changed. Then growth of the vocal cords, which can produce some simple fibrous areas to tumor conditions, it can be produced, like, and it also could be produced to overuse of the voice. Then stress, simply psychological stress or aging also can be cause for the dysphonia in the conditions. But along with that, one of the major issue which is presented as the dysphonia in the clinical condition is a muscle tension dysphonia, which has both psychological origin as well as the structural origin, the pathology could be. So from the point of view of the phonetics and the management part of view, the muscle tension dysphonia is studied, and the muscle tension dysphonia is categorized into 6 categories. and which can be made out with the laryngoscopy. When you do the laryngoscopy, the vocal cord movements are studied, and based upon that pattern of the vocal cord movements, the tension or the tone of the muscles of the vocal cord can be made out, and the appearances would be when there is a isometry features, like the symmetrical movement occurs, like, and the posterior area of the vocal cord is having a more severe contraction compared to the anterior portion. That's the type 1. When both of them are closed more tightly, it is a supraglottic, and the approximation of the vocal cords occur even when there is no sound produced. That's type 2. Type 2, again there could be two categories, type 2 and A and B. And type 3 is when the anterior and posterior supraglottic anterior posterior areas they get contracted, the sound could be abnormal, dysphonia could occur. Or it could be type 4 is where supraglottic posterior contraction occurs more, and the posterior muscles will be contracting more. That's also a muscle tension dysphonia. And the others are psychogenic dysphonia, where everything seems to be normal, but the whole vocal cord becomes more dilated. That's the psychological. And adolescent transition is one more. Adolescent transition is as the patient reaches the age of around 16, there will be some changes in vocal pattern, and this occurs again due to a increased muscle tension. So from the phonetics point of view, whenever there is a abnormality of sound produced, the detailed phonetic study involves these categorization, and the basic treatment there again would be to train the person to produce these conditions. Now, along with that, there could be a functional voice disorders where the patient may not have these abnormalities, but the patient's sounds may be abnormal due to either a structural pathology of or shape of the structures, like, or it could be due to some other external factors which can produce, like laryngeal isometry, the shape of the larynx is not normal, or there could be a false fold compression which can occur again due to stress-like conditions. The same anterior posterior compression is the same as the type 3 variety, or there could be hard glottal attack, that's your hard palate may be more strong, thicker, like. Along with that, the habit like repeated throat clearing, habit of screaming, yelling, habitual breath holding, or during exercise improper glottic valving also can be the cause for the dysphonia. So a study of dysphonia has to be very detailed, like if you go for a phonetic and management of the speech therapy. The speech therapy involves a proper training and identification of these causes and management as such. Along with that, there could be central nervous system pathologies which can produce the dysphonia, neurological conditions, and in the neurological conditions, the treatment protocol would be totally different. Now, as far as the treatment protocol mentioned in Samhitas, Snigdhan, Saraturan, Naran, Apakristadoshan, Nyayanatan, Vamana, Rechana, Bastigishcha, Nastya, Avapira, Mukhadhavana, Dhumalehi, Sampade, Vivishi, Kavalagraheshcha. All the patients of Swarabheda have to be treated with Snehana and as per the protocol. Nyayana is as per the condition of the patient. Vamana, Virechana, Basti or Nasya, Avapida, Mukhadhavana, Dhumapana, Leha can or Kavalagraha can be given based upon your assessment of the condition. Yash Swasakasa Vidhi Aditayeva Choktaha Tamchapi Ashesham Avatarayatum Neteta. All the protocols of the treatment used in Shwasa and Akasa also can be used in case of the Swarabheda. Then the specific treatment would be Sarvabhati Anilaje Bhuktopari Kasam Pibeta, Kasanantaka Vataka Markavas Rasai Shridam, Pitam Vasam Hanti Anilam, Siddham Artagale Rase. In the Vataja Kasa, Vataja Swarabheda, the patient has to be given Ghrutapana after the food, and a Ghrita prepared with the Kasamartha Vartaka etc. have to be given. Vyavaksha Rajamodabhyam Chitraka Amalakeshwa Devadaru Adnikabhyam Siddham Adam Samakshikam. Another of the yoga which can be used in Vataja Swarabheda. Kshiranapanam Pitte to Vivek Sarpihadanditaha. In the Pittaja Swarabheda, Kshira Anupana and Sarpi has to be given. Lishyat Madhurakatnam Churnam Madhukrita Pudam Shatavari Churna Yogam Chabala Churnam Bhapiva. The Madhura Ganadravya with the Madhu Gruta, Shatavari Churna also can be given in Pittaja. In Kafaja, Pibet Katuni Mutrena Kafaja Sarasanche, Lishatva, Madhuvelabhyam, Bhukta, Khadet Katuni, Katura Satravya are to be given. Sarvajam Chayaja Chapi, Pratyakshaya Acharya Bishaka. In the Kshayaja condition, the and Sarvaja, Tridoshaja, it's a Pratyakshaya Vadi. Sharkara Madhumishrani, Sutani Madhuri Saha, Pibet Vayamsi, Yasya Uchi Vadato Abhyataswaraha. Due to loud speech, if the person has an impaired voice, then the person is given Sharkara with Madhu and other Madhura Kashaya Dravyas. With this, we conclude this chapter also. It is Sushruta Samhita Mudra Tantrante, Kaichik Sarante, sorry, the title is changed. It is Swarabheda Pratishudha Rama, Pancharashodhyayaha. Sir. If there are any questions, we'll try to answer. No. Then we'll wind up today.